Soaps and things, reporting live with some more baby news. As you know, my channel focuses around a lot of babies with the dolls and stuff that I'm doing. But I want to bring you some more somber news because this is, well, I don't want to, but this is somber news that I'm reporting because it's news that should be known. So this is called Maternity Ward Shuts Down After Family Calls for Justice in the Death of Mother. The maternal health ward at Centinela Hospital in Los Angeles is finally shutting its doors in October, following an investigation. Many ponder on what this investigation is and what happened. Well, the family of April Valentine filed a lawsuit alleging a wrongful death and negligence of the young 31-year-old mother's death last January. I will have a healthy baby girl. I will have a healthy and beautiful pregnancy. I will not have any complications. These were the daily affirmations expectant mother April Valentine manifested for a baby girl, an experience written on a whiteboard in her room as she prepared for the birth of her daughter Anaya. It was her expectation that she would live and welcome the birth of her first child. However, she did not have that choice. April did not make it out of the maternity ward at Centinela Hospital in Inglewood, California. After tireless and persistent months of protests in the maternity ward is now closing its doors on October 25th, 2023. Valentine's family filed a lawsuit last week alleging 1. Wrongful death, 2. Survival action, and 3. Professional negligence. They filed their complaint with the Los Angeles County Board of Supervisors, alleging systemic and racist practices. Systemic and racist practices. Aha! I brought this up in the last reaction video with Jessica Ross and Trayvon Isaiah Taylor Sr., the couple from Georgia whose baby was decapitated during birth. This brings me back to the treatment of black mothers during their pregnancy months and their mistreatment and disregard of their health. Here's what you ought to know. 1. U.S. maternal mortality rate. I cannot talk for a damn today. Forgive me. U.S. maternal mortality rates have doubled in the last 20 years. 2. Black mothers' mortality rates have 3 times higher than their white counterparts. 3. A Kaiser Family Foundation study showed that even when adjusting for other factors, black women were still more likely to die from pregnancy-related health complications. 4. This is why an L.A. County Department of Public Health doctor has programs like African American Infant Mortality Initiative. Now, funny thing was, I work in D.C. I've worked for a hospital in D.C. That Tuesday, I was getting off of my night shift, and I didn't have the strength because the Mayor Muriel Bowser in the Department of Health was hosting mother and infant, health summit. It was free, and unfortunately I couldn't make it because I got off the night shift and it started at 9 and didn't end till like 5 p.m. That would have been something to go to had I not worked a shift that late, but see, having functions like that, bringing awareness, especially to black and brown mothers, about prenatal health and what type of health care to receive prenatal and postnatal. This is very effective and this is very important. As a woman in her childbearing years, such as myself, even though I'm getting up there, this makes me more so retreat from even experiencing such. It's no secret that our health is being ignored and taken for granted. Well, yeah, that's been like that since way back when. I'll talk about that in some other videos. And sometimes I often wonder, is this going to be my treatment? Which is why so many in the black community have stigmas with going to the doctors and trusting healthcare professionals. Through investigation, it was discovered that the maternity ward could have prevented such a death or occurrence, but failed to do so. Well, duh. This woman was young and vital, 31 years old, which isn't too old to have your first baby. But she died. The Los Angeles County coroner ruled the mother's death on January 10, 2023 was the cause of a blood clot. This could have been prevented. Why did this woman die of a blood clot? Which the hospital failed to assess or intervene. Valentine's partner, Nigel Robinson, the father of her baby Anaya, and her sister, Keisha Cordova, were present with her at Centinela during the labor. Both claimed that Valentine's doctor, Glenn Allen, did not arrive at the hospital for hours. According to Robinson, when he asked about the doctors, the staff told him they could not reach out to the doctor because she will cuss them out, or the doctor doesn't like us calling her. Well, then why the hell are you a doctor? Why the hell do you have this job if you don't like your staff reaching out to you to discover your whereabouts? You knew this woman had a scheduled birth. Why wasn't your ass at the hospital? I mean, what was more important than getting your ass to this hospital and helping this woman have a safe delivery? And if you were stuck in traffic, you couldn't notify your staff so they could maybe prepare in case they had to go on without you? Miss Valentine planned on having a natural vaginal birth for her daughter Anaya. All she wanted was a smooth delivery and to hold her beautiful baby girl in her arms. This too was denied to Miss Valentine. No mother and baby bond, and little Anaya never got to touch or even got to look at her mother, the voice that she's been hearing for her 40 weeks gestation in mommy's womb. Both mother and child were robbed again. Centinela Hospital is guilty as charged, for this is murder. This was murder. This was not April Valentine's dream at all. It was reported that the nurses were inattentive, and Miss Valentine's doula was turned away. Wow, talk about your everyday hospital practices. Valentine's vitals were dropping. She was even pressured into getting an epidural instead of a natural birth that she requested. Soon after, Valentine's legs began to swell and she was regurgitating. Valentine's partner and sister said the deceased soon stopped breathing, but the nurses failed to perform CPR. What the hell? So this woman could have been saved at any moment. So my question pretty much stands. What the hell was wrong with that doctor? And what was the hell wrong with her nurses and her staff? If somebody is losing conscious, you are automatically supposed to start resuscitating this person. This is a code ears, okay? Code ears event. What the hell was going on with these damn nurses? Wow. Minutes later, doctors intervened with CPR, but it was of no use. Of course not. You waited, 7 minutes too long. She passed on. It was reported that Centinela failed to keep records and reports of the patient and failed to notify the family about the patient's pain and conditions. There was even ongoing complaints of rodent activity in the hospital due to a broken door that they finally fixed. And the patient's death, failing to ensure proper ventilation. Thus, she wasn't able to breathe on her own, and she went into cardiac arrest. Again, code ears. This is a code ears. Somebody goes into cardiac arrest. This is a code ears. I work in a hospital. I know this stuff. Since 2000, the mortality rate in the U.S. has risen nearly 60%, with about 700 people dying during pregnancy, and with a year of giving birth each year. More than 80% of these deaths are preventable, according to the Center for Disease Control and Prevention, CDC. The U.S. has the highest maternal mortality rate, among industrialized countries, and black women are more than likely 3 times likely to die in childbirth than whites. This is ridiculous. And it seems within each generation it gets worse and worse. Hence why I am afraid to carry a baby in my womb. I'm not only afraid of the labor pains, but am I going to be around to see this child grow, to see this child prosper? Am I going to be disregarded like Jessica Ross and Travion Taylor? Am I going to be ignored and shunned like April Valentine? I can go on and on and on, and I still have more stories like this to report about baby treatment and stuff like that. Because as you know, what my YouTube channel is about, reborns, babies. But of course, I'm going to get into other things as well. Well, with that being said, folks, I'm going to close it up here. Think about what I said. This is really serious to those in your childbirthing years. This is Baby Doll Soaps and Things signing off once more. Bye, folks.